I'm Pam Seatle at Pearson. With the COVID-19 coronavirus now spreading to several countries which were previously untouched by the virus, concern is growing worldwide, including here in Toronto, where another presumptive case has been diagnosed. Now, Canada's Chief Medical Officer of Health, Dr. Theresa Tam, has described the situation as rapidly changing. She says that because we do not know the trajectory of the disease, where or when it will pop up, it means that the window of opportunity to stop the spread globally is closing. And that, she says, is very worrisome.
It also tells countries like Canada, who have been able to detect and manage imported cases thus far, that we have to prepare across governments, across communities, and as families and individuals in the event of more widespread transmission.
Dr. Tam said it's possible the virus is present in countries other than those that have been identified, countries that have been unable to detect or contain it, which adds to travelers' fears no matter where they're going.
Very concerned about it. It seems to be getting worse from what I understand.
Stay in Canada, I think it's safe, but if going to China, I may have to think about it.
As for the new case here, it's a young woman in her 20s from Toronto. She did everything right, says Dr. De Villa from Toronto Public Health. She had symptoms and wore a mask during her travel in China. Upon arriving at Pearson, she was told by airport authorities to call telehealth, which she did. She was then advised to go to North York General, which she did. She tested low positive and is self-isolating at home.
I think it's very important to note that the whole process that has been followed from start to finish here shows that in fact that the system is working quite well to keep people safe. And as such, at this time, the risk here in Toronto continues to be low.
The new case brings the total number in Ontario to 4, but 3 of those patients have fully recovered. In BC, a 7th case has been diagnosed, the second patient who had no connection to China, which experts say is an indicator of more widespread transmission. Meanwhile, the Canadians who are quarantined in Trenton and Cornwall are all doing well.
The Trenton cohort, we continue to do testing on some individuals. All those tests have been negative, as well as the ones at NAV Canada and Cornwall. And the second cohort is due to be released tomorrow. So that's also good news. And the NAV Canada one, it's day 4, and that's progressing well in that light there.
Officials say we have to guard against becoming complacent as the global risk evolves. And we all need to practice good habits to prevent the spread of all respiratory infections. Many travelers follow them carefully already.
I don't have any concerns. No, I don't. I mean, because I keep myself clean, right? I wash my hands. I'm not touching doorknobs or anything.
Now, in addition to the new presumptive case, Ontario has 9 others that are under investigation. Dr. Theresa Tam said today that Canada is also stepping up its research effort, including joining the international community to try to develop vaccines and treatments.